Hi, so today we're going to talk about supporting someone to get an assessment. And I've particularly left out the word dementia because we're talking about an assessment of symptoms. So we look at a lot of other things. My name's Zena, Aldridge, and I'm a dementia nurse consultant. And I have worked with people with dementia for many, many years in different guises. So I'm hoping I can give you a few tips that might help you or support you to not only identify symptoms, but know what to do if you see them. So in this session, we're going to think about how you might support someone to get an assessment for possible dementia if you notice that they have got signs and symptoms. And we know that's not really straightforward. So we're just going to take you through what you might see, how you might approach it, but recognising that not everyone will want that assessment, and that's okay. So previous sessions have talked about symptoms of dementia and how they can vary. But just as a refresher, we're talking more broadly than memory loss. So remember, dementia is more than memory loss. I know there's lots of narratives around, are you worried about your memory? But it's really important to remember that that might not be the symptom that people present with first. It could be that they have difficult concentrating, they have difficulties with communication, perhaps having a conversation or finding the right words. They might be confused about where they are and how they got there and what time of day it is, for example. They might start missing appointments, or you might see changes in their mood or personality that just don't quite sit right with you and raise your concerns. So it's a really much broader picture than just memory. And actually, as people age, there are some natural degeneration of memory anyway. So people, again, might be really concerned that they are developing dementia when they experience some memory loss, and it may not be anything to do with that. So it's about how you support them to be honest and open about what they might be experiencing, but also how they can get support to have that assessment and possible diagnosis of whether it be dementia or other conditions, or actually to rule out those conditions as well, which is as equally as important. I would have to say, be mindful that actually, as we've said in previous sessions, it's really important to remember that these symptoms may not be caused by dementia. They may be caused by a medical condition or another mental health condition that someone's living with. So it's really important that just because we see some of these symptoms, we don't make assumptions that someone has got dementia. It could be that they are depressed, it could be that they have developed a delirium, it could be that they've got some other medical conditions that have been undiagnosed or are not managed particularly well. So it's really important that just because you see someone who you think might particularly be older and they're experiencing those symptoms, that you make the assumption it's dementia. But what's really important is supporting them to get the right support they need for those symptoms and the right assessment and possible treatment for those. So you have a really big role to play in identifying and supporting people and residents who you might be looking after to get the right support and identification of any problems they might be experiencing. Things to think about in terms of supporting and perhaps broaching these new symptoms might be a conversation thinking about, when do these symptoms start? Are they new? Have they come on quite suddenly? Which then may indicate that there's something else going on as opposed to dementia. Have they been building up slowly over a more longer period of time, perhaps a few months, maybe years? Has the person noticed that they've got issues, or is it their family carers? Are other people seeing what you're seeing? That's really important because sometimes, we do pick up on things that others might not be aware of. So again, we have to be really sensitive in how we broach those conversations. It may well be that the person themselves raises a concern, or perhaps one of their family carers. And they might start to have a conversation with you to see whether you're noticing what they're seeing also. So it's kind of a really gentle conversation that needs to start with those who are affected. And also thinking about how it's impacting on that person's well-being, and is it posing any risks? Is it causing the carer to become distressed? Is the person themselves distressed by their symptoms? So really trying to feel your way around those really subtle changes, but just giving them permission to have those conversations should they want to. But before talking to the person, it's really important to think about how they may feel. Dementia is still a really scary word for a lot of people. So it may be that you don't even talk about dementia. You just talk about those changes that you've noticed. You might say, oh, I've noticed you've been having some problems with your memory. Is that bothering you? Have you noticed that? Think about what might prevent that person going to see a GP or getting support, because there is still that stigma attached, and it may be that actually they're not ready to have these conversations. Does the person think, if they have identified that they've got some memory problems, that it's just a sign of getting older? I often hear people who are perhaps in the early stages of dementia, and we've kind of made that diagnosis and supported them to get some support, and they just say, I just thought I was getting old. I just thought it was a normal part of ageing. So again, if that's their perception, they may not even be thinking that there's something else going on. Could they be really scared about what that change might mean if they do get a diagnosis of dementia? It could be that they think that it's going to prevent them from doing certain things. Driving's a big one. People are really anxious about, is someone going to take my licence away? And the thing is, there's no hard and fast rules. It's about how symptoms affect people, and their ability to cope and manage their everyday tasks that are the things that will define whether that's appropriate. So it's not a hard, it's not a yes, once you get a diagnosis, you won't be able to do this. And more importantly, the earlier we get the diagnosis, when those symptoms are first noticed, the more access that person might have to support and possibly treatment to reduce the impact of dementia for longer. You might also think about, are you the right person to have that conversation? You may not feel particularly confident or competent in starting to have that conversation. So although you've started to notice some of these things, and maybe the person themselves or one of their family members or someone important to them has raised issues themselves or noticed things and started a conversation, you may feel a little bit out of your comfort zone, and that's equally okay. It's then about how do you identify who's the best person to start those conversations and actually take that forward. A lot of families might think there's no point in getting any support or information or getting an assessment, because there's still a lot of people who think, well, there's nothing you can do, there's no treatment available, you can't cure it, so what's the point in me knowing? But what's really important is once people know, they can think about their future, they can have conversations with their family about what they might want at a later stage. They might decide to do things now, in the earlier stages, while they're fairly well and able to do so, rather than kind of wait maybe 3 or 4 years down the line and they're not able to do so. For example, if we knew that we had a diagnosis of terminal cancer, for example, we might choose to do things in those earlier stages before it's too late. And actually, why shouldn't people with dementia have those same opportunities and think, actually, if they've got a son or a daughter in Australia who they might want to go and see, it might be more important for them to do it sooner rather than later, if that's the case. So, it's about putting a positive spin on what the benefits of that diagnosis could be to that individual. And would it be important for them to be supported with that assessment if they were to go to a GP? Is it about persuading them that they don't have to go on their own? Perhaps you as a carer might be able to support them in that process, whether it be in the care home setting or in the person's home if you're working in domiciliary care. So again, really just kind of thinking about the importance of treating this sensitively, because it may be that if we rush into a conversation with someone or push them in a direction too quickly, that we might actually stop them from getting the diagnosis in a timely way. So if you do feel able to talk to the person or their family or a carer, you know, it could be just a neighbour, friend, someone who knows them really well, you know, think about the setting. You know, don't do it in a rushed pace when you're perhaps washing or dressing someone or supporting them to get a meal. You know, think about finding a quiet time in a space where they feel safe and supported. And it may be that you don't do it when they're on their own. You may wait till a family member's there so they feel supported in that conversation. And talk to them about what the next steps might be. Suggest maybe that they might want to consider speaking to their GP about their symptoms or how they're feeling about the situation. And again, you know, you're not suggesting they have a particular diagnosis. You're saying you see symptoms that you think they should get support with. And that's why choosing the words really carefully is important. So you may not even mention the word dementia. You may just say, I've noticed you've had problems with concentrating more recently. You know, you don't seem quite yourself. Your mood's, you know, you're a bit quieter than normal. Or I've noticed that you keep forgetting things. You know, very subtle changes. And actually, if someone says, well, do you think I've got dementia? You can quite happily say, I don't know, but I think that you should get some support and find out about what might be going on. You might start to give them a couple of examples of things you've noticed if they're not particularly aware, but do be really positive about the benefits of seeking that assessment. You know, it may be really important to say to them, look, it may not be dementia, it may be something else. And actually, by going to see your GP, those symptoms might be reduced. It might be that you've actually got a thyroid problem, for example, or perhaps you're a little bit depressed. You know, perhaps your mood is low and that's affecting your concentration and your memory. All of those things. So again, thinking about the positive nature of encouraging them to go and get an assessment. And if they don't respond well to you starting that conversation, stop. As I said, you may not be the right person, it may not be the right time, but you might have prompted them to go away and think about things and they'll come back and have that conversation later. But if you can see someone's getting distressed, you know, don't push it. You know, give them time, give them space to consider what they want to do next at a time that's right for them. Whilst as professionals, we think it's really beneficial for people to get their diagnosis early, it's also got to be at the right time for that person. Just because we think it's the right time, they may not. So it's really important to recognise that. So if you don't feel confident in having that conversation, and that, as I said, that's absolutely fine. These are really quite difficult and sensitive topics. Sometimes you don't know how people are going to be responding. It may be that you don't know the person particularly well. They may be someone that you've only recently met or started to provide care for. So absolutely don't feel pressured that this is your responsibility. It might be that you speak to a more senior colleague who perhaps feels more comfortable with having those more difficult conversations, or you know, they may reassure you that they think perhaps, you know, that there's things that they can do to support you. It may well be that the person already has a diagnosis, but you don't happen to know that. So it's really important, again, to just make sure that that person hasn't got that diagnosis already. I often see people and you know, families will say to me, well, they had a diagnosis about 5 years ago, and actually there's been a lot of professionals who've not been aware that that diagnosis has been made because it's not been recorded properly, for example. If the person's really adamant that they don't want to see a GP, but you're really concerned about them, you think they might be at risk, or you think, you know, that it would be really important to let a health professional know, you can, of course, let the GP know of your concerns. Of course, a GP is deemed by confidentiality not to discuss that individual with you. But of course, if they start to get a pattern of information, it may prompt them to speak to the patient directly. But that's not your concern. If you want to raise your concerns with the GP or another health professional, that's absolutely fine to do so. And depending on where you work, in what setting, that will take different guises. So, for example, if you work in a care home, you may have a GP ward round, or an advanced nurse practitioner or an emergency care practitioner who comes into the building, who could just say, I'm a bit worried about Doris or John or whomever, and this is why I'm worried. Or if you work in the community in dom care, what it might be is you might think about just giving the GP practice a call, but often, with perhaps some consent with the family if you possibly can. But it's really important to remember that if a person has capacity, they have mental capacity, and they decide that they don't want to have these symptoms investigated, they absolutely have the right to do so. If someone lacks mental capacity and you think it's in their best interest to pursue an assessment because you think they might be at risk and that it's posing issues for them and their family, then that's a slightly different matter. But we must respect the fact that not everybody wants that assessment, and that's perfectly okay as long as they have mental capacity and they are safe and they're not putting themselves at risk. However, the other thing on that is, if we think about mental capacity, is it's important to remember if someone does have mental capacity, they are allowed to take risks. They might make decisions that we think are unwise. I have to say, I probably make a lot of decisions that people think are unwise on a daily basis. That's important. That's about living. It's about pushing the boundaries. So remember, we can't make people go to a GP. We can't make people seek a diagnosis. And that's really important to make sure that they retain their dignity and autonomy. So if you're thinking about encouraging people to think about the benefits of an assessment, again, you might not use the word dementia, but remind them that it could be about ruling out treatable causes. It could be that actually they have got a thyroid problem and actually medication will reduce those symptoms and perhaps, get rid of them completely. It may be that that person has had some low mood, and with treatment and therapy, their memory and concentration and well-being will improve. So it's really important to, keep. I know I keep talking about it, but I think it's really important to make sure that you're kind of steering them, because we don't want them to think that we're diagnosing them with anything. It's about prompting them to get that assessment. It's also important for the families who might be a bit reluctant to remind them that actually that diagnosis could be the way of opening up access to the right support and information and advice that they need to be able to live as well as they possibly can with the condition. And I think once family carers particularly understand the symptoms and how they might impact on someone, it can really improve relationships. So again, it's really positive to be able to access that information and support if the person does indeed have dementia. It can, if the person has dementia, enable them to access treatment options, something like Alzheimer's disease, for example. We have medications that can slow down some of the progression of the symptoms, and that's really important for people to understand that there is some hope, there is some opportunity to get that help if they go through the proper processes. Or it could be something like cognitive stimulation therapy, which again helps people to manage some of their symptoms and think differently and feel more comfortable and confident in being able to communicate and retain some of their cognition, which is really important. But even in the more advanced stages, when you're thinking about perhaps people in care homes who've got very advanced symptoms, there's still a benefit to the diagnosis, because what it can do is perhaps inform advanced care planning, it can prompt conversations about end-of-life care, and all those kind of things that would enable that person to have the most appropriate care and support towards the end of their life. So again, there's always a benefit. It's just making sure that you understand what those benefits are and feel comfortable in articulating them. So if you're going to encourage someone to go and get an assessment, it might be worth understanding and explaining to you what might happen when someone goes to a GP surgery, because again, people might have all sorts of ideas about what might happen. So when the person goes to GP surgery, they may see a GP, or it may be that actually the GP sees them in a care home setting. What generally tends to happen is there is a bit of history gathering, is understanding what the symptoms are, when they started, again, trying to think about have they been coming on over time, or were they very sudden? Because we certainly want to make sure that if someone's got delirium, we treat that first. And I'd encourage you to go back to that dementia, delirium and depression teaching session that we've got as part of the set to kind of familiarise yourself with the differences. So that's really important. It may be that they do a little screening tool, so they might ask some questions which might, they might ask people to repeat some information back, they might ask them to do a clock face, and all of those different pieces of that assessment are about testing different parts of cognition. So it may sound, you might think, well, why are they asking those questions? But it's about trying to tease out different ways that the brain works. So that's part of the assessment. Once that bit's completed, if that person's screening tool indicates there could be a problem, what the GP will generally do next is request a blood test. Because what we're doing, we're almost going through this process of elimination. So we start at the beginning, is there actually a problem with someone's cognition and memory? So if we look at what the symptoms, we try and identify the symptoms, we then do the test to confirm whether there is a problem. Interestingly, there's often a lot of people who get very anxious about their memory, and they can do the screening tool really well. And what it does is actually reassure them that there's nothing wrong. So I think that's another positive of getting someone to have an assessment, is saying, actually, you might be worrying about nothing. And I've certainly seen that a lot in people who are worried about getting dementia. So, it's really important to remember that bit as well. But if they do score badly on that test and it would indicate there's a problem, the blood test will be the next thing. And the reason the blood test is done is to look for some of those medical conditions that might be treatable and be causing some of those symptoms. Now, when that blood test comes back, if it indicates that there are some health problems, it would be down to the GP then, or referral on to other specialists, to manage those health conditions. And actually, the memory assessment itself stops at that point, because it's important to make sure that that person has all their medical conditions stabilised. It may be that once that's done, that there's no need to repeat the process because all of the symptoms have gone. But it could be that actually we then repeat the testing if there still appears to be some symptoms left, and we start the whole process again. There may be a need to do an ECG, and that would only be for certain patients who might have cardiac problems that could cause some of the situation or the symptoms that they're seeing as well. Once all those tests have been done, if it's indicating that there could be a possible dementia, the person will be referred to a specialist service, often a memory assessment service. For younger patients, and remember, not all people with dementia are elderly, there are still young people who have dementia, they might be referred to a neurologist to then look at other conditions that might need to be ruled out as well. In the care home, it may be that a GP is able to make the diagnosis if it's an advanced presentation, or it could be again that they're seen by specialists and memory assessors. When the memory assessors come out, they do much more of this kind of what we call cognitive testing. So they use lots of screening tools, they ask more questions. So it's a slightly more longer assessment than what the GP would do. So they're looking at very specific things to try and give them an indication of how the person is affected, because that helps them make a decision about what type of dementia that person might have. They may ask for a CT or an MRI scan, depending on what these other tests indicate, but that's under conversation with the person themselves or family members. Often in the very advanced stages, particularly for those people living in care homes, it probably wouldn't be seen as appropriate to request a scan unless there was a concern that there might be something else going on as opposed to dementia. So I think having a basic understanding about what goes on behind the scenes might actually help you reassure someone that, we're not going to do anything unpleasant to them. It's quite a gentle process, and a lot of it is about talking and engaging and doing these sort of verbal tests rather than sort of physical medical tests. As I said, although there may be a need for some scanning. So that might be reassuring to the person themselves. I did have one lady who thought we were going to put electric probes on her head and do all sorts of bizarre things to her to find out whether she had dementia. And when we kind of told her that it was quite a simple process really in the grand scheme of things. She was much more reassured and actually said she quite enjoyed the screening because it felt like a bit of a quiz. So, you know, it's again alleviating some of that anxiety that people might have. But remember again, you know, you don't have to be the person doing this. And if you want more information about what you might want to look for and how you get support in encouraging that person, it might be that you just get hold of some leaflets that you can leave with a person if they're concerned. So your part of the jigsaw might just be giving them the information that prompts them to do the next bit themselves. You know, think about your role in it. As I said, you are a part of a bigger jigsaw, but what you are is someone who knows that person really well. You've probably got a really good relationship, particularly if you've been working with that person for a while, and you might be the best person to have that conversation. But don't feel pressure to do it, but at least find out where that other support might be. So organisations such as the Alzheimer's Society and Dementia UK have some great leaflets that you might want to have in your back pocket that can be given to family members or to the person themselves if they've got concerns, and enable them to do some of this themselves. So you have a multifaceted role, and actually depending on where you work, at what point that person might be, will depend on what you feel you need to do. But I think it's just knowing that you can make a big difference, and you could be the person that could make a real change for that individual and their family. Thank you.
Thank you for watching. If you would like more information, please visit norfolk-and-suffolk-caresupport.co.uk, where you'll find further training on our learning portal. The link for this website is in the description down below.